our CE credit. This meeting is being recorded. Um, If you're on Zoom, you'll just want to make sure that you've signed in using your full name. If you're here in person, if you would make sure you sign in if you'd like to get that CE credit. So we are giving nursing continuing education credit. You can get a certificate of attendance. And your attendance requirement is you need to pretty much watch this entire presentation. You can only miss 10% of it. And these are the following presenters, moderators, panelists, and the planning committee, which is, of course, Ms. Mabel, myself, Stacy Rader, Alexa, Dr. Cochran, and Kelly Silva. So the learning objectives is to explore issues related to intercultural communication in the clinical setting, develop cross-cultural competencies to improve patient care, examine existing attitudes around global health so that we at the University of Kansas Medical Center move beyond the us compared to them mentality by honoring the strengths of different systems, discuss equity and mutualism, and to pursue true collaboration and global health exchange for everyone's benefit. So here's the information. If you want to take a photo of the slide or write down the code, this is what you'll need to sign in by September 17th at 5 p.m. And this is how you will get your credit for CE. Additionally, Stacy will be dropping this information into the chat. So anyone who joins a little late can still get that. Everybody get it? Okay. So most of you know, those of you here, you're well aware of Mabel and why she's here. But it is part of the Redford Exchange Fellowship Program. Mabel's being sponsored and partially funded by this program for her observership. And the Redford Exchange Fellowship Program was established by the wonderful and generous Redford family in honor of their beautiful mother, a lifetime nurse at KU Medical Center, to bring in nurses from international sites that support our students' international educational experiences. You may not know this, but we do send our nursing students to CMC, Christian Medical College in Vellore, India, in order to give the international nurse or mentor an understanding of the United States healthcare system, and more specifically, the nursing education system and program. The award supports a 4 to 6 week exchange at the University of Kansas Medical Center School of Nursing. And Ms. Mabel's been here, will be here for 6 weeks. And you can read the past recipients of this award. So Arak Seeli Mabel Anarani has her master's in nursing and her bachelor's in nursing. She is a sincere and dedicated nurse leader from Christian Medical College, Vellore in southern India. She has served 31 years in the field of nursing. Anybody that's met Ms. Mabel cannot believe that she has served 31 years because she looks way too young. She is a professor and nurse manager at the Rehabilitation Institute of CMC Vellore. She's been involved in the administrative leadership as deputy nursing superintendent since 2023. She has a passion in the field of rehabilitation services, especially among patients with spinal cord injury, bladder, and bowel programs. So Miss Mabel is a very warm and kind and sincere person, and we're so happy to host her here at KU and to make friendships with her. So Miss Mabel, please continue with the presentation.
Very good afternoon. I'm really overwhelmed with the kind introduction by Ms. Kimberly. I'm really thanking God and for this wonderful opportunity He has given to me, because I never realized that I will be in US for some time in my lifetime. And this is really awesome to have experience in KU. So I will be presenting to you for the next 45 minutes, maybe 40 minutes, about the rehabilitation nursing and also the PMR services, what we provide in Christian Medical College, Vellore. And I don't think 40 days of my experience in KU will be condensed with 40 minutes. I don't know. I need to do justice for this presentation. I hope so. Okay, so moving on to the presentation, I come from India, where we have 28 states and 8 union territories, and we have 22 official languages. So it reflects the vast variety of patients what we get in and around India. And Tamil Nadu is the southernmost state of India where I come from. And Tamil Nadu, if I have to speak about Tamil Nadu, we have 38 districts, and these districts are the administrative divisions of a state. And Tamil Nadu people, we speak Tamil language. That Vellore is north districts of Tamil Nadu, and from where we have our CMC Vellore located. And Vellore district has, would like to highlight the landmarks to you. And there are main 4 important landmarks that I want to introduce to you. So first one, the Christian Medical College, Vellore, which is located in Vellore district. And the second one, Vellore Fort. It's a very beautiful historical place, and it was established in the year 1566. And we have VIT, we call it as Vellore Institute of Technology, which is a world state of art, and it provides the engineering services for our in and around world. And this is another center. It's called Karigiri Center. It's caring for the leprosy patients. It started in the year 1955 by William J. Shefflin, who was very key in in introducing this services for the leprosy patients. And this is away from the district, because those days leprosy patients were not inside any town area, so they were all outcasted, and they were living away from the community. And the American philanthropist, Mr. Shiflin, he came in, and then he was doing his ministry among these patients. And CMC and Karigiri Center, they are partner in caring for those patients. We do send our surgeons going there and doing the reconstructive surgeries among those patients. And about Christian Medical College, Vellore, I'm proud to say that I have studied there, and I'm a part of CMC. And because of this one single woman's obedience to God's call, and this was, began. And in this, Dr. Ida Sophia Scudder, she was living with her aunt in US, and her parents were the medical missionaries. And as they were doing, mother became sick, and she had to come and look after her mother. She never wanted to come to India and settle down there. And as a young woman, Aunt Ida, she was, just as she was taking care of her mother, one eventful night changed her life. And 3 young men from different families, they came and approached her for help, to help their wives who are struggling with the difficult childbirth. At that time, her father was available as a missionary doctor. So when she offered the help, and they refused, because the custom prevented them to receive any male doctors to come and offer their services for their wives. And so they refused and went back, and she came to know that the next day all 3 young women died due to childbirth. And that really shook her, and then she decided, and she believed that this was a God's call, and she changed her mind, and she wanted to commit herself for the healing ministry of Christ. And this incident, always you can find, even in the YouTube videos are available. And this was a event that we all, because of this, that turned out to be a blessed community where we live in Vellore. Vellore is a hallmark for this CMC. It is well known for its committed service up to the entire world. And now we have the CMC, which is catering to the more than 4,400 inpatients. And this particular incident changed her mind, and she went back to New York, and she completed her graduation in Cornell University. And she was among its first group of women students those days. And here in, this is the main campus. This is called Vellore Town Campus. This became, started increasing in the numbers and services which was provided for patients. And we couldn't continued our services, still we continue, but it was giving around 1,500 inpatients, but we couldn't accommodate more patients because we had OPD services and IP services, and more than 50 theaters, operation theaters are running. They are providing their services. Due to the shortage of beds, many times we couldn't admit patients. So in order to avoid such events, so we, from CMC community, I think they started establishing this nearby state. It is just 30 kilometers away from the main campus. And this was established in the year 2011, offering its secondary level of comprehensive medical care. Started with OP facilities, and then now almost 4-5 years back, we have opened it for IP facilities. And medical college soon going to be starting its, admitting students, medical students. And already we have BSc nursing course started with 15 nursing students intake every year. And this is another arena or landmark for CMC in 2022, and we have started the department, the whole Ranipet campus. Ranipet is a district, like Vellore district. It's named after the district. It provides a level 1 trauma center with art and state of art and other facilities. It also has 1,500 bed facility with a multi-specialty hospital and teaching facility. And this is the bed strength that I would like to highlight. And we have ortho block exclusively for ortho patients, and also peripherals. It is mainly the community outreach centers. So health and social affairs. So this is providing the campus for in and around patients from Vellore and India. And further, if you want to contact, and you can also contact through our public relation office or also Vellore website, and you can read more lot about the services what we provide. And Dr. Aida, this was after her retirement, she used to visit the students, medical and nursing and other allied health students, and she used to motivate them a lot. And this is a rare picture. And the vision and mission of CMC is to be a witness to the healing ministry of Christ through excellence in education, service, and research. And through this main focus, we keep it as central to our all the services what we provide. So this is some of the facts and figures. On an average, every year, we look after outpatients and the inpatient beds out of 4,400 beds, and almost this is a turnover every year. And community outreach services, PET scan, CT scan, and MRI. This is just a gist I wanted to just put forth in front of you. So we do have bone marrow transplantations, and we do have renal transplantations, liver transplantations, and radiation therapy for cancer patients. And there is going to be a pediatric block which is going to which was funded by Azimji Foundation, and it's started their work, and almost 1 or 2 years it will start their services. And totally overall, we have 160 ICU beds in our campus, all 3 campuses. And you must be wondering how CMC and KU got its connection. So because of this one gentleman, I think Dr. Mani, Model Mani, so he did his MBBS and MS in the year 1955, and he was a CMC alumni, and he got the the opportunity to come to KU for his 2-year residency program to do his plastic surgery unit. So 69 to 71, he completed his residency program, and he wanted to come back after he finishes his service obligation. So he went back to India ultimately, and then he came back to 1974. He had a close relationship with Dr. Robinson, so who was his mentor at that time. So he came back to KU in the year 1974 along with his whole family, and he became the medical director of the Jean Barbara and Burn Center until his retirement. So after that, he did not stop with that. He wanted to really have this collaboration going on. So many things that he has done, I read through his articles. But I wanted to highlight the three important things what he has done. He started this fellowship like Robinson International Studies Award, which was awarded for the KU medical students, and also so those who can those who got the opportunity, they came to CMC and had their cross cultural learning. And also, secondly, he initiated the Model Fellowship program for the students and the faculty of the College of Nursing and CMC. So they can apply and get the award, and then they were able to come. I think previously 5 people have come like that. Last person was come in the year 2022 when Dr. Mani was alive. So he has initiated such kind of things so that this, the intercultural and cross-cultural learning going on. And he was also awarded Professor Emeritus of Surgery by the University of KU in 2009. So this, and the third one is he has funded the Model Fellowship Hostel for the visiting faculty and the students, those who come to CMC. And rehabilitation services, next I would like to highlight whatever the services done happening in India. So this is mainly the Rehabilitation Council of India, which is also set up in the year 1986. Through this two conventional model, they provide services for patients with disability. Institution-based rehabilitation, it represents the services which are provided for the patients, like patients who are admitted in the hospitals. We have rehabilitation centers, and they provide care through this multidisciplinary team members. Community-based rehabilitation is the one which is, they go to the community and then take care of patients, because you know that the reaching to the hospital is highly challenging for such patients, because you have a lot of road facilities and a lot of things here. But in our, in India, if you come, and it's very highly challenging experience you will face in terms of road facility and also the crowd, what you see in the on road. So it's difficult for these patients to come and get their services in hospital. And also the health system in India is such that we don't have, everyone don't have the insurance covered for their medical expenses, so they need to pay from their pocket. And this is a very good project, and really many patients are getting benefited out of this. And this is the next, I would like to highlight the PMR services in India in CMC. So in CMC, if you look at Dr. Mary Burgess, she was the founder of rehabilitation in CMC. And she's an alumnus of CMC who became paraplegic in her 20s, and she was wheelchair bound. And she wanted to actually aspire OG specialty, but she couldn't further proceed because of this tragic event happened in her life. So she was, along with Dr. Paul Brun, who was also working along in Karigiri, taking care of leprosy patients. So he came forward to help her out, and he found that she was sent in the year 1966 to do her rehabilitation program in Rusk University in New York, along with Dr. Paul Brandt. So she got the training. After that, she came back to India, and then in CMC, she has just started with 27 beds in 1966, and that's how rehabilitation. So it was a different campus apart from the main campus. She got the CMC started this rehabilitation program for spinal cord injury patients and patients with traumatic brain injury, and also children are also affected with cerebral palsies. They are also rehabilitated. So this is a WHO collaborating center for development of rehabilitation technology, capacity building, and disability prevention. So this is the PMR OPD still running. Monday to Friday, we have the OPD going on. And actually, it is happening in Ranipet campus and also in town campus, Vellore, and also rehabilitation campus. The rehab campus doesn't have the OPD services, but we have the IP services. So they do rotate their services, conduct clinic. We have, like you have 3 units of PMR. We do have 2 units of PMR. Each unit is manned by the head of the department and consultants, and the PG registrars. They provide the services to patients. And PMR IP services, we started with the, and we know that day by day it was increasing. The demand was more, and many patients were on the wait list. So we have increased our services to acute and subacute care. and also long-term rehabilitation. And these patients, we get the referral from the unit, other internal medicine unit, and they come and see patients. And once they are medically stable, they are moved to the acute and subacute facility. And there they will be, because any patient, they are left with all this paraplegic and tetraplegia, it's very life threatening, and sometimes they feel like not doing anything in their life. So it's quite challenging for the medical and nursing and other allied health members to mold the patients to take up the rehabilitation services. Unlike here, they are very independent, and even in their 80s, and I see them very independent and taking very lot of motivating to take up the rehabilitation services here. And long-term rehabilitation, because it is out of the campus and we don't admit anybody with active infection and so on. So those patients are managed in the main campus. And only long-term rehabilitation, we provide intense therapy with 6 hours of therapy. So morning 8 to 10 and 10 to 10:30 to 12:30. In between, we give them the break for them to do the ICC, and they can come back later on after for the therapy. And after lunch, we give 2 to 4:30. It is the time allotted. And we do have physical therapist and occupational therapist, speech, and we also have other multidisciplinary team scheduling them for various therapies. And this is about a private ward. I couldn't take up the general ward pictures for you, but this is the one area where I am working in the main campus and also in the long-term campus. So I do spend my time in depending on the classes in the College of Nursing, because as MSc faculty, we are supposed to take care of the clinical services in this side, as well as we do have academic responsibilities, teaching students, conducting exam, all that stuff what we do. And it is fully packed. Our schedule will be fully packed, and based on the schedule, we move around between the campuses. And okay, so all of you know this is about working together. We really cherish with each other, taking care of patients. And I have seen this as, working togetherness, how you contribute to each other, and how you do the safety council and practice council. A lot of things that I have also learned over a period of time when I was here. I really enjoyed working together with the team. It's a teamwork. And rehabilitation nursing, we do have a lot of challenging experience in our field. And we had missionary leaders who were pioneer in our institution and who were really helping us to come up to this folk. And College of Nursing is a pioneering institute in nursing education, which is also there in the other campus. And really, they had really worked very hard to bring up this standard in our college and in our CMC. And this is the picture, very rare and old photograph, showing the first 7 nurses with whom Dr. Ida was closely working with. And she had difficulty in training them because we did not have any school at that time, School of Nursing or College of Nursing. And these were the people for helping her in and out of, in the IP facility, OP and perioperative care. These are the 1946, we had initiated our baccalaureate service program. And the college was admitting 50 students in the beginning every year. And this is about, I would like to explain to you about the organogram of CMC with the position of our administrators. And you can see the dean and so nursing superintendent. They do have they have autonomous in their services, and they are under director, and director is under the council of CMC. So nobody owns the CMC, and it is the council which owns, and they have the term 5-year term for the administrators to take up their position, and the council will choose the next director. And our director will be finishing this March, and we will be getting the other new director. And nursing superintendent, under her, we have the head of the department, and nurse managers are the MSc faculty who are taking care of the dual responsibilities, and the charge nurse and staff nurse and multi-purpose health worker and the aides. So they are helping in terms of the direct patient care. And the nursing superintendent is helped or with 3 associate nursing superintendents who will be involved in HR manpower planning in all 3 campuses. And 4 deputy nursing superintendents also, they are very much helpful. And this is the administrators and those who are currently available in CMC. So Dr. Vikram Matthews, and he is the medical superintendent. Dr. Rajesh, Professor Alice Soni, she's the nursing superintendent, and Dr. Vinita Ravindran, she's the Dean College of Nursing, and he is the principal, Dr. Solomon Satish, and he is looking after the medical and allied health courses in medical college. And the general superintendent, he is looking after the engineering services and the general services, and he is the treasurer of CMC. And the rest of them are the deputy directors and the other associate. A nursing superintendent office at the organogram, and the nursing superintendent is overall responsible for all patient care, whatever happening, and the nursing services and the nursing services available in all the campuses. And she is assisted with other associate and deputy nursing superintendents. And this is the nursing leadership at nursing superintendent office. And we have three associate nursing superintendents and 4 deputy nursing superintendents. And rehabilitation nursing in CMC, it started, I told you, it started in the year 1966. And we have a lot of struggle in the beginning to set up the institute. And currently the nursing care is focused mainly about the mobility issues and the issues with neurogenic bladder and bowel, nutrition, spasticity management, and pressure ulcer, and psychological and social welfare, and sleep. So these are some of the main nursing care which is focused. And training nurses in abroad, that is another way moving forward in our institution. And not only nurses, and also other healthcare team members, they take up this. Every year they send out notice for application for this STF, Senior Training Fellowship. And nurses, previously we had the charge nurses went to Australia and England to take up the training, and they have set up a rehabilitation institute, and which is also, I can recollect whatever you are doing, and we are also able to do in a small or big base there for our patients. And this is the one thing that I have come as a first recipient of Redford fellowship in the clinical services in KU. And I have come here to undertake my training in the area of spinal cord injury rehabilitation, especially the bladder and bowel program. And training other nurses in India and beyond India is our mission. So we do have visitors, and visitors, and also they have done the short-term course for 3 months from Malawi. So they just 6 of them, they came last year, and we do give them the training on orthopedic and rehabilitation. It's not rehabilitation alone, but both orthopedic and rehabilitation. They can go back and set up their own unit in their own country. So I chose spinal cord injury rehabilitation for my fellowship because I have observed many patients, they get admitted during their early years of life, and majority of them are male, and in our culture male is a special, get the special credit in the family. So they do struggle when the male person and young person is affected with spinal cord injury or traumatic brain injury. The whole family struggle because it's a family oriented system we have, and all of them, they come to visit them, and they will be around, hanging around there. And majority of them, they get cervical injury, and also they, most of our patients do die because before reaching the hospital, because of the, maybe we don't have the primary care where they get the first aid, or they are not managed properly with the log roll and things like that. They do come to the hospital very late, and by the time many of our patients die. Bowel management, I want to just highlight, it's a constant challenge. And nurses, this is mainly, I have experienced many patients, they don't want others to care for them when they are, dependent on bowel and bladder, especially the young people. And so it depresses them, and they don't move forward with their rehabilitation program. So we do manage them with laxatives and suppositories, enemas, very hard and impacted stool when we get. And we do advise them we have a dietitian who's managing their role, and they come and assess the patient's daily intake, and they also help them out to have the regular bowel program. And adequate fluids and digital stimulation and evacuation, this is the one area where we teach our patients when they go out of hospital, and also the family members. It's a real challenge. Here they just, it's a private area, very sensitive, and they don't want to, open it to anybody. Just like that, I was really feeling very shy to stand next to a patient, because they feel, they don't want allow anybody else to come near to them when they do the bowel program and bladder. And when husband is admitted, wife and parents, they don't take care. Only wife, she has to struggle with the family and children, and things like that. And the husband always expect somebody to care for them. They don't want to be independent. So it's a constant challenge, but I hope I have learned a lot from this Rehab Institute, and I'm sure I'll be able to apply, and I'll be able to apply few of the areas whatever I have learned. And this will be really going to be a different experience for our nurses too in the days to come. Bladder management, spinal cord injury patients often experience neurogenic bladder, and we manage them with indwelling catheter, and some of them with suprapubic catheter when they have tetraplegic, and we cannot advise them with intermittent clean catheterization. But we do teach the relatives, and I have a medical doctor who's a very young girl, and she's also continuing her studies, doing this ICC and going back in her wheelchair, doing all sorts of things. So they get a lot of motivation when they come into the rehabilitation center. They are broken out, and they don't want to do anything in their life. They do express their suicidal active ideas, but still in the midst of all that, we do have many patients coming up, and colorfully they are going into the sports related activities, and they won a lot of prizes. And really it's heartwarming and overwhelming experience when we see them doing very well in their life. And nurses do take care of patients, and apart from the overall patient care, they do celebrate special days with our patients and families, which is a special moment for them. And patients are admitted with the family. Without family, we don't admit in our institution and anywhere in India. And weekly spiritual session we conduct, but it's not mandatory, but many patients volunteer to participate for their families. An education session for the family conducted by the nurses, because we have very good setup here where you meet them one-on-one and then give them. But there we need to, and anytime we can walk into the room and then talk to them. And any topic we can just open up and talk. It's not like here we have to really get permission and things like that. But I find it really difficult to move around. But there we can just, they have the freedom, and they want people to come and talk to them and get a lot of ideas and training for them to take on. So we do conduct demonstration and on clinical skills to train and become a competent nurses to manage these patients. The nurse manager or the charge nurse, the blue uniform is the charge nurse in the unit. So they take up and from the nurse managers, and we have conducted, these are the nursing students. They're also watching the mannequin, how we give care for patients. So every unit plan their in-service education and on-the-job training for our nurses and nursing students. So I would like to highlight all this while I was talking to you about the acute care management, and this is the long-term care management that I will be presenting to you. And we have 100 beds in the long-term care. This is the campus. It's called Rehab Campus. And it's a big campus. We have this is the entrance of the rehab center. And we do have patients after the hours, because they stay there to almost 4 to 6 weeks or sometimes 3 months. Some patients, they don't want to go. They want to stay there and then continue their therapy. And once they go well, and then only they want to go. So many patients, they don't, here you fix up that day, okay, this is the day they will go, because there the patients pay for their treatment, so they decide when they want to leave the hospital. And we do have Center for Stem Cell Research. It's called CSCR, and we do have Spinal Cord Regenerative Lab there, and we do have a collaborative research going on with the University of Alberta, Australia. And in this area, nurses start their work with a prayer, and after that warm-up exercises with the staff and team members. And charge nurse Here I have seen charge nurses working closely with interdisciplinary team, and there also we have charge nurse working coordinating the clinical rounds and the patient care, and we receive all the team members, including the students. They are the students. So we get allied health students, PT, OT, and all of them, and the patient with their family. They sit and they have a discussion one-on-one, and the management plan and the goals are finalized, and then they meet them every alternate days, how things are going on, because the doctors don't come to the rehab center every time in the long-term care unit. All the nurses take a look after their care in case any emergency or anything, that we can message them, or they come, they are available in the campus. So in the evening also we have an on-call person who will be able to come and take care of the patients anytime in the day or night. And this is our support staff and team members. They are very commendable and dedicated team, because they need to transfer patients. We don't have higher lift facility and all sorts of things, and the commode and the transfer devices available for us. And we depend on these people, and we also train them how to mobilize patients safely using their whatever the available measures, and they maintain cleanliness and assist the rehab ambulance services. In case, I told you, it's available out of our main campus. So in case any patients become sick, and we do send them along with them in the ambulance. And so this is one event. And patient education is a majority of our focus is on education, because we educate and supervise how they manage their patient care, because ultimately after 4 weeks or 6 weeks, they need to perform their care independently. And Monday to Friday they have the schedule, and Saturday is also half a day. Nurses work for 44 hours per week, and it's we have to take our off day and off within that week, so that we can be able to function very well, and we can be productive. And apart from this, 59 days of paid leave also the institution provide for all the workers, and 6 months of maternity leave and things like that. A lot of benefit we get. That's why we don't face any shortage of nurses in our institution. Many of them volunteer to come, and there are a lot of almost 1,000 nurses are waiting, because we do train them and then keep them on the wait list, so that as we move, because we do have, our attrition rate is less than 1%. So we do have a lot of nurses, they want to join CMC, and we have our own students coming in, and we do have our students going up for abroad, and taking up a lot of roles in terms of their, masters and diploma nursing students. When once they become staff and they want to upgrade themselves, they become, or they want to take up BSc. So we do have people going out, but we have nurses waiting for us to join. So we train them and keep them waiting, and they will be working somewhere. Once we send out the notice, they can come and join our institution. So this is one event which is very, very heart-touching event in my life, because recently I just joined, last year I joined a long-term rehab center. So I did not know how this Mela works. And really every almost 3 months back they've planned. December itself they plan for the February. Every February we don't have our family meetings also, because we know that, I know some of our social worker, they were mentioning that they try to avoid their family marriage or anything during the month. So they dedicate that month for the conducting Mela. Mela means, in Tamil we call it as Mela, means it's a festival, grand festival we conduct for the patients to come, because they really want to come back to rehab center where they got the training. So every year we conduct, and this is in our calendar, February month, and we conduct brain injury and spinal cord injury Mela, where traumatic brain injury patients, they come in their stretchers with a relative, and we have seen them how they were earlier when they come into rehab center, and this is done by the long-term care facility, not in the acute care facility. And they really, because they stay over a period of time, they really cherish the experience, and they come one-on-one, they make friends, and they will have a lot of association between them. Any problem they encounter, hey, I had this problem, did you have this problem, how did you manage? So they get along, and they know better than us how to manage their lives. And the spinal cord injury Mela is conducted for 3 days, and day one, a lot of meeting go before that. And we have a lot of committees. We work together, and we have every week we will have meeting, and towards the Mela time, and we'll have almost every day what's up, what's happening, what are the responsibilities, how are we going to be doing. So every time the committee will work out, and then we really update our events, how it's going to be. So it was very exciting to see. Day one, we welcome them. We have in the entrance itself, we have a welcome desk, and we receive them as if we are receiving the guest for the our own family wedding. So this is how we prepare the area and then welcome them, and then take them to the medical checkup area, where the doctors and other team members, nurses, work closely with medical team to check their sugars, to check their blood pressure and vitals and other things. And we do have cystoscopy and cystometrogram, CMG room available for these people, and ultrasound. Everything is conducted free. They don't have to pay for anything. And at the end of 3 days, they'll get the medical certificate and the summary, whatever we have done. So this is one event. And second day, they do all sorts of sports. And it may be a chess or carom indoor. Who can play, go out and play. We have conducted running race for them, wheelchair running race. And they have done javelin throw and shot put and lot of things. You must see their enthusiasm. They really look forward for such kind of events. And day three, this is the day three event, where we have the cultural program by nurses, and also this is the group session. So they can raise any kind of question answer to the healthcare members. And I have done this. This is the way. A lot of questions when they raise, and sometimes we get the answer from the group itself. Sometimes we don't have to tell. We just have to moderate the group session, and also the cultural events by the even doctors team. Everybody will come forward, so they enjoy watching people, and it's really heart touching events. Friday, Saturday, Sunday, these 3 days we work to have this Mela. And staff welfare programs department wise, we have a lot of in-service education go on. This is one dietary classes we have arranged with a dietitian. And many of them, they come forward and ask questions and learn. This is one education session for our nurses. We do conduct mock drill for our CPR and fire mock drill, because we are away and we want to maintain safety for our patients. And this is the other regular sessions we have. Nurse counselor for our nurses in our institution. She's Ms. Devaki. So we have to send a mail to nursing superintendent to get her facility. So we have arranged, and many of our nurses go through a lot of family issues, and also with the issues when they see patients, they are not going. Sometimes it's draining our people are also really struggling how to really face such challenge in their life, and we don't know how they will be able to motivate our patients. So we do have regular Bible study conducted for our nurses. This is Reverend Joseph. He's the chaplain for us. And support staff meeting, which is conducted in the long-term rehabilitation. She is Dr. Judy. She's the current head of the department for EMR Unit 1 and 2. So we do have, because they don't have time, they'll be running between the pillar and post, and I have to manage the entire team to be very cooperative, so that the things will go on very well. I do get the updates every day, what is happening in our institution. In the evening time, they do update me. And this is one international visitor. We do get many of them, but I just wanted to mention that she is a OT specialist, and she has come for the visiting the facility, whatever we are providing. And he is the Dr. Rajdeep. He's an engineering person who's also taking care of the gate lab and for our patients. So this is the leaders of our institution from PTOT and social workers. I would like to mention the PMR calendar. You can see the February month ABI Mela, and the next week is the Spinal Cord Injury Mela and Sports Day they conduct. And this is like, Spinal Cord Injury Day, OT Day, P&O Day, and Amputee Mela Day, and Rehab Campus, MET Campus. This is for the staff members. Then this will be given to us and in the month of December, and then we'll have to update for the next year. And this is going on quietly. And at every PMR calendar, nurses do actively participate and make sure that, and we are very much thankful for the wonderful services that we are able to provide as a community. So my visit to KMC, I came to here, came here to observe the physical setup, how it is really going on, because we have the acute setup and the long-term unit. So I thank Ms. Michelle to taking me to the daycare rehabilitation center, Rehabilitation KC. So I was able to, really look at what are the services they provide, because time is a one constraint for our patients. Nobody wants to be in the hospital for a longer period of time. And we are also looking at ways in which why we can reduce the number of days in the hospital they can spend. So I'm also, surprised to see daycare facilities for our adult patients. We do have children coming for the daycare rehabilitation area in the main campus, but I got this idea about having daycare facilities for our adult, especially the youngsters. They can go for work and come back, and maybe in the evening or Saturday, Sunday, something like that. It came in my mind. I'm sure we'll be able to work out for good reason. And clinical skills in rehabilitation nursing, like bowel and bladder program, I was able to observe, and this is one area that we think that we are doing the best, but we wanted to know whether are we in line with the international standards and policies, protocols, because we need to also update now and then. So every 2 years we update them. So maybe I have a lot of learning and insights from KU. I'll be able to update it in the days to come. And I wanted to train nurses, so I was looking for a model or some kind of video. So I got a lot of ideas from here, how we can train our patients and our staff members and the students. So for the physical setup, I have understood that, okay, we can have the bowel stimulator for each of our patients. When we teach them and they go back, sometimes they feel hesitant to take up, and sometimes parents, they have to do for their children. So maybe they can also use this. And I have observed commode and toilets when they go for tilted space commode. So these are some of the things which are available. We do have wheelchairs, but we do not have for specific purposes. So maybe we have to also go and put forth this to our administration. And higher lift facility, I was just thinking how it can be incorporated into our system. I think community, it's a already built area, so I don't know whether any modification is possible now, but at least they can have one bowel room, or the bladder room, because we have a general beds and a private bed. Not every room has a single patient. So we do have struggle with our space in the general area, where 4-5 patients are in one cubicle and only the curtain will be there, and we don't have much space to go move around. So I'm just thinking we can have a separate area for shower facility and also bowel room, where we can have this facility, where or a higher facility, or a hoist, something we can have and train our nurses. We didn't have one Dr. Henry went to UK, and he came back and initiated, and he had bought one hoist. And he was asking me, sister, tell your nurses and other people to use it, because they don't want to use it. They are very manually, very comfortable to transfer patients manually. And changing their practice may be difficult, but still I think this will really bring a lot of, comfort for our patients. And this daycare rehab services for our patients, I think this will also, I have pictures. Maybe when I go back, I'll present it to my administration and also my team. They'll be able to take up this move forward. And also like wipes and other things that we have, Foley wipes. We still have that, care, catheter care giving using the solutions. So maybe we have to get rid of that. We have to also use such kind of wipes, which is very convenient. Maybe cost-wise, we have to work out. But my main aim is to certificate. So a lot of nurses are there in our unit, just with their degree or diploma level. They will come and work, and day-to-day learning, we do all sorts of teaching, but I want to certify them. Maybe they can go through the e-learning modules, and then we can certify. And we do have short-term course for orthopedic and rehab. I am just thinking of having for spinal cord injury alone. And they can just take up this as a e-learning, or we can have it for 3 months. Even other country or other mission hospital nurses, they can come and be benefited. And I'm just looking at the way in which by nurses take up the extended roles. And I'm sure, Ms. Anna, thanking you, because every little bit details, I think I was able to learn, because I was having a schedule to go around with each of you. I think that may gave me a lot of ideas and understanding how to move forward. I think I was with Miss Angela and clinical nurse specialist Miss Janet and nurse practitioner Angela. Really, it was an eye-opening experience for me, and I am really grateful that this kind of learning we have not had in our area, because we think, okay, what we do is the best practices. So here, I think I am going to put forth the proposal for bowel and bladder clinic. So we can have BBC in our PMO OPD itself, where the nurse educator can train our family, and in the OPD as well as IP consults, they can get and go around and do the services. Bladder volume index is the one that we were not doing it. We used to send patients for only PVR to do it in the urology OPD. So nurses can also take up this and do the BVI for after admission or after removal of catheter, whether within 4 hours, if they are not voiding, they can do it and find out. And community outreach activities along with multidisciplinary team we do provide, but that also will be very helpful for our patients. And prepare education modules for our patients and families. Here where we are teaching them, I told you, a lot of languages patients come with, and we don't have translator facility. We manage with actions and something, but some patients, I think, use their mobile phone to get the translation happening, and this is one area where we need to make in different languages. So this is one area that I need to work out, and I need some models or AV8s so that patients can put their hands on and how they need to do that. That will be really changing or motivating them to do it, because they have a lot of questions. And this is another area that I'm very much interested, because I need to know that many mission hospitals, they send out photos. Okay, my patient has this problem. How do I manage? They are working in a remote area where they don't have access to even sometimes network. So these people, when they come, we can go there and then train our nurses, or we can receive them with some kind of, maybe 1 or 2 days, and we can give them the teaching and educate them about the BBC, what is all about. And I'm just interested to publish a book on nurses handbook on spinal cord injury management. So this will be, even if they are not coming, we can then just send out as copies, and it can be made available with pictures and other things. So this is about clinical teaching and program, and especially here in terms of bowel management, time scheduling is I really appreciate it here, because we have patients every time, night staff, they have to do their bowel program and go. So maybe that urgent, then they have to hand over things like that. 4 to 6 is the time they do the bowel program, early morning. And they have to hand over everything they finish and hand over to the day nurses. And I find many of them, they come, during the therapy, they will have accidents and come back. And it disturbs their quality of life. And it is really embarrassing situation for the patients to move in and out in between the therapy time. So maybe we need to, schedule the time based on the, maybe we'll have to check with the, unit, and scheduling them maybe in the daytime or in the evening time, or in the, we have to make it different for each patient. It has to be individualized. And position for bowel program, that's another area, because we follow only left lateral position in the bed. We don't transfer patients and give them the normal position. So that also we need to look at it, and designate areas for bowel program. And bowel huddle every week, because I have seen here exclusively for a bowel program alone. I was with Miss Mallory for one day, and it was really good to look at how the each of the aspects we look at it. And safety committee meeting with multidisciplinary, because we do have meetings, but we don't have this for this purpose, and maybe it can be initiated twice a month. And Bristol stool chart, we have I have told them, and I have educated our unit, but it is not mandatory that they need to chart about after they finish their bowel program. So maybe it has to be incorporated into the daily schedule of charting. Diet and medicines, that will be also looking at how it can be improved. because we don't get particular schedule like OTPT in the daytime. In the acute management area, we don't have a schedule. We don't get the schedule. We go into the therapy room and give the medicines and come back. And we don't have, we disturb them during the therapy also. So maybe we'll have to also schedule differently for them to have. And research is another area of interest. And as nurse managers, we do have to have our research and publications. So I'm interested in qualitative experiences of patients undergoing bowel program. We do have a lot of things that going on. Sometimes we just close our eyes, do things and come back. And it may be experiences or collaborative research among patients with spinal cord injury, which will really help to improve our care in the days to come. And I really want to appreciate each and every one of you who has taken care of me all this while. It's a real second home for me. I was having a lot of anxiety because I never traveled alone. And I always go with my husband and my children. And this is first time I have to be in the airport, don't know right and left. And it was really a difficult time. But when I came and landed here, and I didn't have struggle because I do have problem with my network. I can't reach out to anybody. But from Office of the International Programs, I really want to appreciate Ms. Kimberly, Stacy, and Alexa, who were from the time they were helping me in their emails, assuring things for me, and Ms. Anna, and yeah. So a lot of people really behind my experience. And I really want to appreciate each of you for your time you have taken for various, I know all of you are busy because I have seen through, but in spite of that, you made it possible to arrange each and every experience for me. And from Dean's office, I think Michelle was very helpful for me to, just pitch in for, I did not know how, I was wondering how she got my number. I did not know this network earlier. So I happened to see, and out of her interest, she took me for baseball game and ability and lot of, even School of Nursing. I was, I was given opportunity to observe the skill simulation lab training and activities. So it was really wonderful, and I really want to acknowledge each of you in the acute IP rehab unit, Ms. Kimberly, nurse manager, and the unit coordinators and the charge nurses. They gave me freedom to move around. So that was wonderful thing that, I know that from my residence, when I move, I am comfortable to move to rehab. From there, I'll go anywhere. So that is the drop and pickup point for me. So from Cambridge Towers, and I have been with Janine and Ashley from BH43, and I'll be working closely with the doctors team. I really want to appreciate all the doctors who will be helping me in the future. I think tomorrow onwards I'll be with in the Sutherland and Spine Center. I'm looking forward. A lot of learning went ahead, but I really want to appreciate and lot of experience. I think this is one time in my lifetime I will never get back. But really, this is awesome. I really cherish each and every day, whatever it happens to me. And I never felt any time lonely because I have a group which, who were helping me in any minute, whatever, whenever I need something. And there is somebody helping me. I know somebody is there. So we have a WhatsApp group, and that was really helpful. Anything I can text. In the beginning, jet lag was I never experienced. So they were telling me. So I was sitting in the midnight. I was sitting in the midnight working in my computers. I didn't get sleep. When they were sleeping, I was sleeping here. And when I have to come for work, and I was struggling with the time management. But really, it's awesome. And I think I really want to appreciate the CMC administrators and the KU for offering me Redford Fellowship, because otherwise it is not possible for me to, as an individual, to come and learn this for me. And this is going to be, I assure you that this will be a life-changing experience for our patients and as staff members and students learning. And everywhere when I learn, and the wristbands, so many things I can go on telling, but due to the want of time, I have learned a lot, and I have a lot of things in my paper written down, and every day I write the diary, whatever happened, wherever, whenever, anything happening, whomever I have met, I have written down everything so that I will not remember in my lifetime, because I'm going to make it as an album, and so that it will be, even my grandchildren can see. So I really want to appreciate from all our team from CMC Vellore, And I wish that this partnership will continue in the future. Thank you very, very much.
Just a reminder, we have the end of program celebration table, and also Dr. Besa, who's here for the Food Fellowship. So that's next Thursday on the 18th, right? So hopefully you can stop by with friends, with family. So thank you so much. The burger, like, with you, and then you did a beautiful job on her stuff.
Oh, thank you.
I can't imagine.
I'll know better for next time. I studied to run twice. And I capstone it at the National Charity Hospital. And
We have a partnership.
I went through in my capstone there. In my undergrad, I went to the Florence Food Years. So I know how valuable that was. It only had it's a professional.
Oh, okay. Sure. Sure, I can take it.
Maybe just get a copy of my.
Where do you want to be, packet, like, where do you want to be?
Right under, I don't know.
Credit for presentation?
Oh, I mentioned they are.
Right here. Okay, so I know it's not like beautiful.
Yeah.
I'm like, Miss Maple, we'll see you this
Yeah,
week in the.
okay.
We'll go back and. Oh, here now. I thought it was her.
Or unless you want to, is that her?
This is Miss.
Okay. We want, or on mine.
Oh, you're gonna take that. Where's it? Just like, or up.
Right there.
Or no,
Right outside. Okay, we're on there.
We'll go inside.
Okay. Okay, I'm taking Fonda some food and then going to meet with her. Let me see what she wants to give me.